Welcome to our YouTube channel Medical Subjects Made Easy. Today's topic is pharmacotherapy of diuretics. 1. What are diuretics? Diuretics are medications that increase urine production and promote the removal of excess water and salt from the body. 2. What are the main uses of diuretics? Diuretics are primarily used to treat conditions such as high blood pressure, edema, fluid retention, and certain kidney disorders. 3. What are the common types of diuretics? The common types of diuretics include thiazide diuretics, loop diuretics, potassium-sparing diuretics, and carbonic anhydrase inhibitors. 4. How do thiazide diuretics work? Thiazide diuretics work by inhibiting the reabsorption of sodium and chloride ions in the distal convoluted tubules of the kidneys, leading to increased urine production. 5. What conditions are commonly treated with thiazide diuretics? Thiazide diuretics are commonly used to treat hypertension, high blood pressure, and mild edema. 6. What are the adverse effects of thiazide diuretics? Adverse effects of thiazide diuretics include electrolyte imbalances, such as low levels of potassium, sodium, and magnesium, increased uric acid levels, which may lead to gout, and increased sensitivity to sunlight. 7. When are thiazide diuretics contraindicated? Thiazide diuretics are contraindicated in patients with known hypersensitivity to thiazides, severe renal impairment, and anuria, no urine production. 8. What complications can arise from thiazide diuretic use? Complications of thiazide diuretic use may include hypokalemia, low potassium levels, hypotension, low blood pressure, and dehydration. 9. What is the typical dosage of a thiazide diuretic? The typical dosage of a thiazide diuretic varies depending on the specific medication, but usual starting doses range from 12.5 mg to 25 mg per day. 10. How do loop diuretics work? Loop diuretics work by inhibiting the reabsorption of sodium and chloride ions in the ascending loop of Henle in the kidneys, leading to increased urine production. 11. What conditions are commonly treated with loop diuretics? Loop diuretics are commonly used to treat edema associated with heart failure, liver cirrhosis, and kidney disorders, as well as hypertension resistant to other diuretic therapies. 12. What are the adverse effects of loop diuretics? Adverse effects of loop diuretics include electrolyte imbalances, such as low levels of potassium, sodium, magnesium, and calcium, increased blood glucose levels, and ototoxicity. Potential hearing loss. 13. When are loop diuretics contraindicated? Loop diuretics are contraindicated in patients with known hypersensitivity to loop diuretics, severe electrolyte imbalances, anuria, and hepatic coma. 14. What complications can arise from loop diuretic use? Complications of loop diuretic use may include hypokalemia, hypotension, dehydration, and worsening renal function. 15. What is the typical dosage of a loop diuretic? The typical dosage of a loop diuretic varies depending on the specific medication, but usual starting doses range from 20 mg to 40 mg per day. 16. How do potassium-sparing diuretics work? Potassium-sparing diuretics work by inhibiting the reabsorption of sodium in the distal tubules of the kidneys while preserving potassium, leading to increased urine production without causing significant potassium loss. 17. What conditions are commonly treated with potassium-sparing diuretics? Potassium-sparing diuretics are commonly used to treat hypertension, edema, and prevention of potassium loss caused by other diuretics. 18. What are the adverse effects of potassium-sparing diuretics? Adverse effects of potassium-sparing diuretics include hyperkalemia, high potassium levels, gynecomastia, breast enlargement in males, and menstrual irregularities. 19. When are potassium-sparing diuretics contraindicated? Potassium-sparing diuretics are contraindicated in patients with hyperkalemia, severe renal insufficiency, and anuria. 20. What complications can arise from potassium-sparing diuretic use? Complications of potassium-sparing diuretic use may include hyperkalemia, fluid and electrolyte imbalances, and interactions with other medications that increase potassium levels. 21. What is the typical dosage of a potassium-sparing diuretic? The typical dosage of a potassium-sparing diuretic varies depending on the specific medication, but usual starting doses range from 25 mg to 100 mg per day. 22. How do carbonic anhydrase inhibitors work? Carbonic anhydrase inhibitors work by inhibiting the carbonic anhydrase enzyme in the kidneys, leading to decreased reabsorption of bicarbonate and increased urine production. 23. What conditions are commonly treated with carbonic anhydrase inhibitors? Carbonic anhydrase inhibitors are commonly used to treat glaucoma, to reduce intraocular pressure, altitude sickness, and specific types of seizures. 24. What are the adverse effects of carbonic anhydrase inhibitors? Adverse effects of carbonic anhydrase inhibitors include metabolic acidosis, electrolyte imbalances, kidney stones, and tingling, numbness in the extremities. 25. When are carbonic anhydrase inhibitors contraindicated? Carbonic anhydrase inhibitors are contraindicated in patients with known hypersensitivity to these drugs, severe kidney or liver disease, and adrenal gland insufficiency. 26. What complications can arise from carbonic anhydrase inhibitor use? Complications of carbonic anhydrase inhibitor use may include metabolic acidosis, electrolyte imbalances, fluid and electrolyte imbalances, and decreased renal function. 27. What is the typical dosage of a carbonic anhydrase inhibitor? The typical dosage of a carbonic anhydrase inhibitor varies depending on the specific medication and indication, but usual starting doses range from 250 mg to 500 mg per day. 28. Can diuretics be used during pregnancy? Diuretics should be used with caution during pregnancy, as some diuretics may cross the placenta and affect the developing fetus. The use of diuretics during pregnancy should be discussed with a healthcare provider. 29. Can diuretics be used during breastfeeding? Most diuretics are compatible with breastfeeding, but certain diuretics like thiazides or loop diuretics may pass into breast milk and potentially affect the baby. It is important to consult with a healthcare provider before using diuretics while breastfeeding. 30. Can diuretics cause allergic reactions? Yes, diuretics can cause allergic reactions in some individuals. Symptoms of an allergic reaction may include rash, itching, swelling, severe dizziness, or difficulty breathing. If any of these symptoms occur, immediate medical attention should be sought. 31. Can diuretics interact with other medications? Yes, diuretics can potentially interact with other medications. It is important to inform healthcare providers about all medications, including over-the-counter drugs and supplements, to avoid potential interactions. 32. Can diuretics cause dehydration? Yes, diuretics can cause dehydration, especially if excessive fluid loss occurs through increased urine production. It is essential to maintain proper fluid intake while taking diuretics. If you found this video interesting, please like the video and subscribe to the channel. Thank you.